More than 100 years ago, another pandemic was taking place. The Spanish flu had killed thousands and infected many others across the nation. Omaha was hit hard by it, but eventually restrictions were lifted when cases started to decline. But as reporter John Madden found out, the opposite of what everyone hoped for started happening, causing some concern for our current day situation.
The traffic around Omaha is busier than it's been in recent weeks, as parts of the city have reopened.
I mean, it's a different pandemic, but we've kind of been through this before.
Back in 1918, Omaha was dealing with the deadly Spanish flu, a virus that spread just like COVID-19. The first cases were reported in the beginning of October. Restrictions were put in place shortly after. Theaters, schools, and restaurants closed, and people were encouraged to stay home.
By the end of October 1918, people were tired of the restrictions.
David Bristow of History Nebraska says once cases and deaths started dropping, restrictions were lifted on November 1st, as long as people followed social distancing and places like theaters were not running at full capacity.
But immediately the theaters were full and people were going out to restaurants and people started behaving as if everything was back to normal. And then there was a big celebration on November 11th for Armistice Day, the end of World War I. And the cases started going up again.
After cases and deaths spiked, local health commissioner E.T. Manning considered restrictions once again.
Once you have loosened the restrictions, you have a very hard time psychologically trying to get people to accept them again.
Mary Lyons Carmona with the history department at UNO says Manning faced political fallout from that idea and therefore chose not to put restrictions back in place.
None of the politicians wanted to be the bad guys and say, nope, we have to go back.
One thing that did change was ordinances passed in January that fined people $15 to $100 who left their homes during quarantine.
$15 doesn't sound like much in today's money, but that would be a considerable threat for somebody in 1918.
Both historians agree when places open up, capacity rules need to be enforced. Social distancing is a must, and things like masks, which were frowned upon back in 1918, are still necessary.
If you're saving somebody's life, a little bit of discomfort is worth that.
In Omaha, John Madden, 3 News Now.
Nearly 1,000 people in Omaha died from the Spanish flu. Lyons Carmona says Health Commissioner Manning, who was frustrated from the fallout of not being able to put restrictions back in place, did not classify all the deaths as flu-related. Instead, some were as a result of fever or a severe cold, leaving some to wonder how many more people actually died from the virus.